Former acting director of the CDC, president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser, and executive vice president of the Robert Wood Johnson Foundation, and recently a member of the Biden Transition COVID-19 Advisory Board, Dr. Julie Merida. Both of them have a joint op-ed in USA Today titled COVID-19 Vaccine Rollout Needs a Shot of Equity. Doctors, it's good to have you both. I want to dig deep on your piece in just a moment. But Dr. Besser, let's talk big picture before we dive in a little bit about where we are in the vaccination rollout. It remains true there are an awful lot of people in this country who qualify for it by age or by need and still can't get it. We reported earlier on some new partnerships in the state of California between state and federal government to open up some stadiums as vaccination sites. How is this vaccine rollout going now, 2 weeks into the Biden administration?
Well, Willie, what I can say is it's moving in the right direction. We're seeing more opportunities, more venues for people to get vaccinated, and that's a good thing. Just to think that it's only been a year since this virus was identified, and already there are tens of millions of people in this country who've been vaccinated. That's terrific. What really worries me, Willie, is that, as we've talked about before, this pandemic is not affecting every community in the same way. Black Americans, Latino Americans, Native Americans are being infected, hospitalized, and dying at rates that far surpass their proportion of the population. And the advisory committee to the CDC that was recommending who should get vaccinated first, given that there's not going to be enough vaccine for everybody right away, it will take time. Instead of targeting people by race or ethnicity, they decided to target people by risk, and by risk of exposure and risk of dying. So first it was to be healthcare workers and those in long-term care facilities. But right after that, it was going to be all of those people who are working to keep our economy going, people who are working in our supermarkets and food production, our first responders, our teachers, those people who can't work remotely. A very high proportion or disproportionate percentage are people of color, and so you will address the issue of equity if you're going that route. But a lot of states have abandoned that and said anyone over 65 can get vaccinated, and once you do that, you're overwhelming the system and you're not protecting those people who need protection the most.
So let's read a bit of the joint op-ed. You both write this, quote, "The nation has lost sight of the fact that while this pandemic is affecting every community, it is not affecting every community the same. Black, Latino, Native Americans, many of whom are frontline essential workers, are being infected, hospitalized, and dying at rates that far surpass their proportions of the population. Given this reality, we must do everything we can to ensure that more of them get to the front of the vaccination line." So, Dr. Merida, why is it? Because we did hear early on in this process that once we got our frontline first responders vaccinated, it would move into these essential workers like the ones that Dr. Besser just laid out. What happened to that plan?
My sense is that there was a lot of pressure from the public in terms of needing and wanting the vaccine. And so I think that there was this tendency to try to want to satisfy people's needs and desire for the vaccine. There is anxiety, and we all are anxious about wanting to get our vaccine, so that's understandable. But I think the thing we have to keep in mind is that there are other things that we can do to continue to protect ourselves. So, and there are insufficient supplies of vaccine to vaccinate everyone who is at higher risk. So the key things are focusing on things like mask wearing, social distancing, avoiding large crowds. Those kinds of things can make a big difference while we're waiting our turn to be vaccinated. And critically important is to make sure that we're making the vaccine accessible to those people who have the highest risk for serious disease and death. And those are the communities of color, harder to reach communities that have historically been underserved and mistreated in the past.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.